Good evening, everybody. This is Dr. Kurt Woeller checking in here. I appreciate you joining me for tonight's webinar hosted through Great Plains. We're going to talk about brain inflammation and autism, something called microglia activation. I've done this presentation in the past. There's some duplicated information, from previous lectures, but some new information as well. So I want to make it as relevant as possible for you, whether you're a parent listening in or a practitioner listening in. And then, as these things get recorded, they're on the website, for a long period of time. So the information is just out there for people to learn. So with that, let's go ahead and get started. Before I get into the bulk of the presentation, I just wanted to let everybody know, if you are a healthcare practitioner, that could be a doctor, that could be a chiropractor, a nutritionist, a acupuncturist, whatever, and you want to learn more about how to implement the organic acids test from Great Plains into your practice, we are holding these one-day intensive seminars throughout the country. We've done a number here in Seattle, Houston, San Francisco. We're going to be going to San Diego, Washington, D.C., Canada. So these things are on a rotation basis, usually about once a month, every couple months. So I want to encourage you to check out Great Plains' website and just go to greatplainslaboratory.com, and you'll see the icon for the one-day oat seminars to see if there is one in your particular area. Okay, so tonight I'm just going to do a brief overview on brain development and the immune system, components of brain inflammation, talking more specifically about microglia and how microglia become activated with regards to inflammation, and some things with regards to abnormal brain connections in autism. There's an organization called Stop Calling It Autism, which sprung up a couple years ago, and they actually have some really good information about the use of ibuprofen and other things. And I think more than anything too, they've also put together kind of a cohesive plan of action that you can learn about through their organization. They have a Facebook page, and you can just go to stopcallingitautism.org as well and learn more. And then we'll talk about some natural remedy options. I'm going to introduce the concept of medical cannabis with regards to some of the research that's coming out with respects to cannabidiol and the use not only in autism but in things like Alzheimer's. And then we'll end our discussion with regards to hyperbaric oxygen therapy. So let's just do a brief overview here on brain development and the immune system. And the thing to keep in mind is that we produce a tremendous amount of immune chemicals that keep our immune system healthy and active. And some of these immune chemicals are not only produced by the immune systems themselves, but other cells in the body to have an oversight or a regulatory effect on the immune system. The primary immune chemicals are called cytokines, and these are small proteins that essentially what they do is they initiate an immune response, and they can also maintain an immune response for a prolonged period of time. But like any immune response, eventually if it's particularly against an infection, you want that immune response turned off or at least turned down, so that we don't have constant stimulation in the immune system that is just too much and goes overboard, because that's where we start to have problems with regards to inflammation. The most notable cytokines are called interferons and interleukins, and they play a wide variety of roles. So they not only attract immune cells to a site of infection, for example, they can also have a direct killing effect on certain cells. They help to mediate the inflammatory response, and that's beneficial because inflammation in the short term gets blood flowing, gets nutrients flowing to a specific area, and also they stimulate B cells to help produce antibodies, and they have a regulatory effect, as I mentioned before. And if you've had the flu or a cold, you've all experienced the influence of cytokines. So that fever, the fatigue, the malaise that you get that occurs with a viral infection is due to various cytokines that are being produced in the body to try to process that specific virus. Now, there's been a lot of research into abnormal cytokine production in autism, and looking at things like tumor necrosis factor and interleukin-1 beta and all these different things. Interleukin-6, by the way, here, IL-6, is interesting because there's some crossover research into the chronic fatigue immune deficiency disorders. And it turns out that interleukin-6 actually stimulates the brain in something called the hypothalamic pituitary adrenal axis. And what it does when it's chronically high is it can overstimulate the brain to overstimulate the adrenals. And that can lead to adrenal exhaustion or stress over time for people as well. Now, there has been a lot of research from different researchers. This Dr. Singh out of the university, a professor at Utah State University, looking at pro-inflammatory cytokines in autism. And I actually was involved in an article research study way back in 2008 with a Dr. Aristo Lujani in looking at the effects of natural killer cells in autism, and actually found that in a significant proportion of kids, their natural killer cells are low, and natural killer cells are these cells that sort of naturally cruise through the body to attack cells that have been infected with viruses. Now, when we're talking about the anatomy in the brain and what we're getting at as far as what's the activity going on at the cell level, we're really talking about what's happening at the level of the neuron, and specifically what's happening at the synapse. And this image here on the left is a neuron, a nerve cell, and it's connected. You know, these things talk to each other. So when the cell body is activated by an electrical impulse, it sends this electrical impulse down the axon and then releases chemicals on the other side through these axon terminals. And in between one neuron and the next is a synapse, okay? And this is that gap space in between the end of an axon and then the next cell body or dendrite of the next cell. And so we release chemicals. This could be serotonin, it could be dopamine, it could be, you know, something else. And these things all complex with these receptors, these lock and key mechanisms here to activate the electrical activity in the next nerve cell. You can have problems in not being able to produce enough chemical, not being able to bind that chemical, not being able to uptake that chemical, having too much chemical sitting around in the synapse for too long, and causing problems that way. So the human brain, you know, from a developmental standpoint, actually has kind of an unusual developmental pattern. Most brain development occurs during the last trimester of pregnancy and that first 2 years after birth, when there's really this tremendous growth spurt in brain development. And that's why for young children in that last trimester, it's such a vulnerable time if they're exposed to things, whether it's pharmaceutically, environmentally, chemically, for things to, or problems to occur. And it turns out that these areas of rapid growth are the areas that tend to control higher brain function. Emotional control, memory and language function, higher mental processing are all developing rapidly at this time. And the reality is brain development continues into our late 20s, and some people would certainly say that you can still be working and developing, you know, brain stability and function, you know, all the way up until advanced, you know, ages, depending on how active you are mentally. So if we look at some of the areas that are involved with kids on the spectrum, we can see that the frontal lobes often are affected, and that's an area that's involved in planning functions. When you decrease frontal lobe activity a lot of times, there's a lack of sense of awareness, or I should say a sense of danger, for example. Hippocampus, amygdala, all involved in memory and emotional memory. The temporal lobe, particularly for kids who have language problems, is a big area. And the cerebellum is an area that is proprioceptively taking in information to try to keep the sensory and the motor system in balance. And actually there's some information, this is kind of a side note, but many of the Clostridia bacteria produce toxins that are known to be, infiltrate into what's called the vagus nerve. And the vagus nerve takes that information up into the brain, and particularly into the cerebellum. And those toxins are known to actually interact with different cells in the cerebellum that can cause sensory and motor imbalances. it also turns out that some of those areas in the cerebellum are highly regulated by GABA. And we know that GABA is important from an anxiety and emotional stability standpoint. Now, when you look at MRI and PET scanning images, many times there's an overabundance of synapse connections at birth. And basically the analogy would be is having a bush or a tree that has too many branches. And what needs to happen is these branches are pruned over time, and that usually occurs over the first few years of life in childhood and adolescence, so that the synapse and the neuron connections are more synchronized. They're at a higher functional state. So generally between age 4 to 8, those language areas become thinned out and more functional. The brain starts to move into a state of higher development. 11 to 13, the language areas are maturing even more. 20s, the prefrontal cortex starts to mature even more so. And this pruning is essential for decreasing excess neuronal connections so that it's not so much static and confusing information going on, and we get a much more synchronized brain. Well, it turns out that the pruning and the migration of these nerve cells is heavily linked to cytokine production. Okay, so it's the time sequences of these immune chemicals that help to regulate pruning and help to regulate the migratory effect of these nerve cells. Also, glutamate levels have a control over that too. It also turns out that methylation, this area of research in autism that has been around for years, methylation is critically important from a pruning standpoint as well. And we certainly know that a lot of kids on the spectrum have methylation issues. But the reality is that anything that disrupts the cytokine levels, disrupts the methylation system at that time, can alter normal brain development. And that can be a laundry list of things. Metal toxicity, chemical toxicity, adverse vaccine reactions, viral and bacterial infections. You could look at potentially things like pharmaceutical drugs if they were being used. I mean, there's just a host of things that may be causing it. So let's shift gears partly here and talk about what are some of the components of brain inflammation, specifically the microglia cells. Well, if we take a look at the brain, we have something called a blood-brain barrier. The blood-brain barrier is analogous to like the lining of the digestive tract. If you have inflammation in the gut and you get a breakdown of the gut lining, you get leaky gut. Well, the blood-brain barrier kind of acts the same way. It keeps the bad stuff out and tries to let the good stuff into the brain area. But if you get a breakdown of that blood-brain barrier, you can now get bad stuff into the brain that shouldn't be there, and it triggers inflammation. And that's essentially what's happening here, is you get a breach of the blood-brain barrier, and you start to attract these nerve cells. Now, the two main nerve cells that we're talking about are things called astroglia and microglia. Astroglia are these cells that make up the support mechanism of the brain. They help support the blood-brain barrier. They're also involved in repair. They help to bring nutrients into the areas where the nerve cells live. And then microglia. Think of microglia as the main immune cells in the brain. And they're constantly on the lookout for bad stuff getting in. So they look out for bacteria and pathogens and other stuff that necessarily shouldn't get into the brain. And when there is, they activate, they attack, and they create an inflammatory response to try to deal with that invasion in the short term. The problem is when these microglia don't turn off. Some of them become activated, and they become chronically activated. And so we get the potential for ongoing chronic inflammation. Now, this is just an image here of microglia, these little blue spindly-like cells around a blood vessel, okay? And so what this blood-brain barrier is it's a cellular barrier that borders the blood vessels that are entering the brain. And so we'll get certain things that can cross over and certain things that can't. This is a retinal scan, and these, you can see here, these green spindly-like things is what's making up the blood-brain barrier and the microglia encasing themselves in the blood vessels in the eye. Well, it turns out that if we look at some of the research in Alzheimer's, that microglia can become activated by these abnormal proteins called amyloids. And the amyloid beta proteins will activate microglia and essentially induce what's called microglia activation or activity, and that generates a lot of inflammation. So this is an ongoing area of research in Alzheimer's, and this also tends to cross over with regards to the research in autism as well. This is just an image here of microglia cells attacking one of these amyloid plaques. Now, an interesting side note, which I don't really go into greatly here, but it turns out that beta amyloid actually has an anti-pathogen effect. And it is considered a peptide that actually can be activated or produced in response to infection. And one of the things it's induced in response to is chronic candida. So there's the question, is Alzheimer's in part, certainly not all of it, but in part possibly linked to some type of chronic candida problem? It also turns out that beta amyloid is an activator for a specific enzyme called IDO. And IDO, what it does is it converts the amino acid tryptophan into a biochemical pathway called kynureninic and quinolinic acid. This is something that could be picked up on off of an organic acid test from Great Plains. Now, I don't see quinolinic acid levels real high, or excuse me, commonly high in kids on the spectrum, but I do see it, enough times to know that it's occurring. The overproduction of quinolinic acid is neurotoxic. It also has a damaging effect in the brain and can also generate brain inflammation. So it's not just about doing blood testing for viruses or giving ibuprofen or doing hyperbaric oxygen therapy. This is another reason why the organic acids test is so important to run, is to not only look for yeast and bacterial toxins, but to look for these other markers too that can be an indicator of metabolic activity that could contribute to oxidative stress and inflammation. I'll do some webinars on that in the future, more specifically. Okay, so we know that microglia, these immune cells in the brain, can be activated by these beta amyloid proteins seen in Alzheimer's. And we know that beta amyloid can be produced or induced production by chronic infection, i.e. bacteria, candida, etc. So the chronic microglia activation effect can be real damaging. And we can have something that has a direct inflammatory effect on these microglia, lipopolysaccharides, bacterial toxins, beta amyloid, here we go right there. And these things start to generate these different chemicals, tumor necrosis factor, nitric oxide production, hydrogen peroxide, oxygen-free radicals. Those then have a secondary neurotoxic effect, causing cell death and damage. And we get a vicious cycle. So we're basically left in this cyclical loop that just doesn't turn off. This was a fascinating article that came out in 2005 in from the Johns Hopkins University Department of Neurology, and Annals of Neurology in 2005. And what they were looking at is they were looking at the brains of deceased autistic individuals and what types of immune chemicals were being produced and how much inflammation was occurring. And really what they found, what they came away with, was that they felt that the immune system was definitely playing a role, that in a proportion of autistic individuals, and that really future therapies need to be developed to try to attack this problem. So here's kind of a summary of what they did. So they examined tissues from 3 different regions of the brain of 11 deceased individuals with autism, age 5 to 44, and that essentially who had died of accidents or injuries. And they measured the cytokines, these immune chemicals in the cerebrospinal fluid of 6 living individuals with autism who were aged 5 to 12. And what they found, cross-checking this, was that there was active neuroinflammatory processes occurring in the cerebral cortex, in the white matter of the brain, and mentioned here notably in the cerebellum. Remember I mentioned the cerebellum is a problem of dysfunction for many individuals on the spectrum. They also noticed that the microglia were chronically activated and that there were other types of pro-inflammatory immune chemicals that were quite elevated. So again, sort of confirming that there is some type of active inflammatory process in some individuals on the spectrum, and that further research needs to be done. So what are some of the other potential triggers for this problem? Well, viruses can certainly do it, okay, whether it's the herpes viruses, cytomegalovirus, whatever, that certainly can be a trigger for brain inflammation. Bacteria, strep, other types of bacteria. We now know that certainly Clostridia can be a trigger. Candida, as I mentioned, there's a lot of things going on with Candida, and just through the effect of inducing beta amyloid production could be, okay, Lyme and other co-infections, that comes up sometimes. And essentially what happens is these chronic infections prime the microglia, and the microglia shifts, or the brain shifts, into a state of overdrive. And this hyperdrive, this overdrive of the immune system stimulates these inflammatory immune chemicals. We then get an overproduction of glutamate, and we just get the cyclical problem we've been talking about. Okay, and this is just kind of a recap. You can sort of figure out what may happen here. If we are activating microglia chronically, what do you think is going to happen to the brain connections that are supporting those areas? Well, and what generally happens is many of these axons, these nerves, become injured. They become inhibited from functioning. And in extreme cases, the synapses themselves degenerate, so we can't get cross-cell communication anymore, or we get cell death. Okay, so let's just kind of review a few things about abnormal brain connections in autism and see where things may fit in a little bit here. A lot of the issues from a neuroanatomical, neurophysiological standpoint in autism is that the longer the connections are, the more complex problems we can have. And what this research is looking at is that there can be a local effect where there's sort of this over-connection problem, where there's maybe too much communication, too much synapse activity, not enough pruning going on, and that there may be a long-distance communication underactivity. So the communication across hemispheres may be compromised, whereas locally in the temporal lobe, we also may be getting a confusing message because there's just not enough synchronized electrical activity happening. So it's not only just a localized regional issue, it's a cross-hemispheric problem from right to left and left sides of the brain. One of the areas that is looked at from a neuroanatomical standpoint and is the communication network between the right hemisphere and the left hemisphere is called the corpus callosum. And this is a bridge, essentially. This is a neural bridge that unifies both hemispheres. And there has been, documented evidence that in some individuals there can be, corpus callosum fiber tract abnormalities where certain areas are just not connecting or not communicating effectively. And the problem is that this really influences a large part of the cerebral volume. So just a small region of a defect may have profound global effects throughout the brain. As I mentioned before, if we've got problems in the cerebellum, well, that is going to not only affect the way the brain is receiving sensory input, but it's also going to cause problems in motor output because it's the input sensory-wise. It's the information our cerebellum is taking in that orients ourselves to space, and then it communicates with the cerebral cortex to try to provide information to have smooth, coordinated body movements. And a lot of the gait issues we may see in autism, many times the self-stimulatory and the sensory-seeking behavior can be linked to abnormalities coming from some of these areas here. I don't have a slide on this, but one of the things I wanted to kind of throw out there, to the parents listening, is a very interesting area of research is looking at things called primitive or primal reflexes. And these are reflexes that all of us are born with as a newborn. But as we grow and we crawl and we walk and we're moving our arms and limbs in different ways, these primitive reflexes start to become, I guess you'd say, incorporated back into the nervous system. And it's important because that means there's a higher level of functionality within our nervous system. And it's not just our arms and our body and our limbs and our legs and our trunk, but it's a unifying field effect that this integrated nervous system has. And they've actually been able to track now and look that some of these retained primitive reflexes can definitely have an effect on language development. Certain primitive reflexes can definitely have an effect on attention and socialization, mood, emotional states, anxiety levels. So what I would encourage parents to do is just look up primitive reflexes in autism. And sometimes you'll get occupational therapists that know about it. We'll incorporate some of that work. There are training manuals. There are videos online. There are courses that I've had parents attend where they learn how to assess their child from a primitive reflex standpoint and then incorporate that into their occupational or physical therapy sessions. Sometimes it's just simple little exercises done at home, but they can make a world of difference. And it's interesting. And research I found out about, I just didn't know the name. I mean, I've known about some of these things. I just didn't have the name or a place to kind of put it all together. So maybe for me, I was kind of late to the game. But it's one of those things that isn't sort of technically a biomedical treatment, but I think is an important thing to be aware of. Okay, so let me go back real quick here. Any chronic stimulus from a toxin, okay? So think about what that could be. A protein left over from an organism, a mold, a heavy metal, an infection of some sort. They can all be triggers for these microglia. The other thing is it's not just the microglia themselves, but it's also what's happening along the cell surface. It's these receptors that become chronically activated too, or damaged, and that becomes a problem. When you start to get damage within a cell, that cell now becomes vulnerable to get rid of. The body makes an attempt to get rid of it. One of the drugs that has actually been quite beneficial for many kids that I've seen over the years, particularly with regards to severe anxiety, impulsivity, and sometimes aggressive and self-injurious behavior, is Namenda. Now, Namenda is a medication that is primarily used in Alzheimer's disease, and what it does is it blocks something called NMDA receptors. And these NMDA receptors become chronically activated, or overstimulated, I should say, by various substances. It turns out that glutamate, and excess glutamate, can be an activator of NMDA receptors, and excess quinolinic acid, something you can pick up off of by looking at the organic acid test from Great Plains, is also an NMDA receptor promoter. So Namenda, has definitely been beneficial. Usually 5 to 10 milligrams per day has worked well, and you certainly can use a lower amount. I've been finding it's more difficult to get it covered by insurance anymore, but it's still out there as an option. Now, there's some research that things like theanine and nutritional lithium can also have a regulatory effect over these NMDA receptors. So L-theanine, for example, has been something that's been used in a number of states. I've used it with kids who have a lot of anxiety issues, and it seems to be helpful in some. Usually 100, 200 milligrams a day, sometimes upwards of 400 milligrams a day seems to be effective. And then nutritional lithium also has a regulatory effect over these NMDA receptors. And oftentimes I've used nutritional lithium and theanine together, to have a better improvement overall from an anxiety and cognitive standpoint. Usually the nutritional lithium, you're looking at anywhere between 1 to 5 milligrams. Sometimes in more severe cases, using something like lithium orotate upwards of 20 milligrams, that's probably more in adults, is necessary. But lithium is one of those things that can be helpful from a brain health standpoint. And that is something that actually can be pretty accurately evaluated by doing a hair analysis. Okay, well, what are some other problems that may be occurring? Neurological inflammation can certainly occur from just the overproduction of things like nitric oxide. And it turns out that nitric oxide will deplete glutathione. Any of these chronic infections, when you activate chronic microglia, activity is going to generate nitric oxide and these oxygen-free radicals. And there's things that can be taken, from a supplement standpoint. Vitamin C certainly, N-acetylcysteine can help, glutathione can help, and there's some other things like resveratrol, which we'll talk about, can be helpful as well. Certainly foods, most of them, honestly, are these polyphenols, things found in fruits like blueberries and cherries, broccoli and parsley. I get it. I understand that, some of the kids have phenol problems, and so it's kind of hit or miss proposition whether it can be universally applied. But, I think you kind of get the point that there's a lot of different types of antioxidants that can be, very helpful. And also evaluated, and the levels can be looked at, from things like the organic acids test. Glutathione is one of those special remedies that has been around a long time. A lot of the studies have shown that many kids on the spectrum are deficient in glutathione. Transdermally, it works pretty good. And if I had my choice, I would do something like the liposomal glutathione, which is an oral liquid, and that tends to work pretty good. Usually about a quarter teaspoon for every 30 pounds body weight twice daily for maintenance. Doesn't mean you couldn't go higher, but that's kind of not a bad place to start. And New Beginnings Nutritionals carries that liposomal glutathione. The intravenous glutathione can work great, and I've seen a lot of kids benefit from intravenous glutathione. It's just not something readily available. It has to be done through a doctor's office, and that can be far and few between depending on where you live. And also, again, it's a blood stick. You've got to have, it has to be a needle, put into your child's arm to have that done. Now, once the needle's in, the process is pretty quick, but it's not something readily available for most people. So the liposomal glutathione or the transdermal is not a bad way to go. And this is an image here of lipoceutical glutathione from New Beginnings, and again, approximately quarter teaspoon per 30 pounds body weight twice daily. One little side note, if you read off their website, is you can actually sweeten it a little bit with a little bit of stevia. It's not bad tasting. It just smells kind of like rotten eggs. So just keep that in mind. But New Beginnings has some tips on how to take lipoceutical glutathione. Okay. Let's talk about this organization called Stop Calling It Autism. And again, you can go to stopcallingitautism.org. So this was an organization that was started a number of years ago by a family out of Texas, and it was primarily to try to research the idea that brain inflammation is a major component in autism, primarily based on some of the information that I've already talked about, and really the belief that the immune system is playing a direct role, which I certainly believe it is in many kids. And it was really an inspiration based on their son Daniel, and this was Daniel before autism, with autism, and then essentially after losing his diagnosis. So just a quick background on Daniel's story, as shared by the Stop Calling It Autism group. He was born in 2004, neurotypical, attended to do, responsive to his name and normal eye contact till about the age of 18 months, and approximately started developing some words around, the age of 1 year. At about 18 months, he stopped responding to his name, started to see some deterioration in his health, and interestingly developed something called vitiligo, which is actually an autoimmune skin disorder, where there is a pigment change or a loss of pigment as the cells become damaged. At about 30 months, his autism became more severe following a viral infection, age 4, he developed another viral infection and had really high persistent fever. So the parents actually implemented some ibuprofen just to kind of help make him feel better. And what they noticed was that his awareness was improved, he was calmer, and he actually started speaking a few words that hadn't, actually had not been there for quite some time. They eventually got something called a Spec Scan, and this is a brain scan that looks at metabolic activity in the brain, and it's very good at picking up at brain inflammation. And basically they felt that it was likely contributing to his autistic symptoms. Now this is a sample image of a Spec Scan. This is not Daniel's image. But as you can see here, it's looking at metabolic activity throughout the brain. And this is just an example of a Spec scanning machine. And there are different types around. So it's just kind of interesting information. And a doctor reading this can get some insight into, hey, we've got underactivity in one area, overactivity in another, and try to get a better understanding of what's going on. So parents started to research things with regards to brain inflammation, looking at microglia activation. They kind of recognized that the ibuprofen was helping their child, and they felt that maybe this is something that might be an ongoing therapy. So they actually started initiating treatment for chronic virus. They were treating gut infections, fungal infections like a lot of parents do, and they started administering ibuprofen along with some high-dose probiotics to try to offset some of the gastrointestinal effects that can occur when you take ibuprofen, and they continue to see benefit. By the way, ibuprofen is in a class of drugs called a non-steroidal anti-inflammatory drug. The problem with these things is they're notorious for causing some GI discomfort if they're taken chronically, because they can cause some irritation in the stomach and the intestines, and one way to combat that is by not only taking them with food, but also using high-dose probiotics to try to buffer it. Okay, so at about 3 years, Daniel started to progress, and eventually was moved off the spectrum. He no longer needs the medication. Vitiligo went away, and they saw great improvements in speech, and essentially he went on, and based on their indication from the SEIE group, became very social, playing sports, doing well in school, and making friends, which was fantastic. Okay, so for all of you listening, go to stopcallingitautism.org and start reading some of their information. The basic outline of what they're advocating is doing some initial blood work, and then every 6 weeks or so getting follow-up blood work, looking at blood chemistry, looking at blood counts, to make sure that we're not getting any liver function or kidney issues. And then about every 6 months come back and repeat a much more comprehensive immune panel. Now, they did a really nice job in breaking these things down and doing this kind of research. I can't verify that these specific codes are still accurate. These codes on the left, this is an old slide. But, your doctor could get updated information. Quest Diagnostics and LabCorp are two of the biggest reference labs in the country. So they have these panels, and they all have these individual lab tests, okay? And what they're doing, whether it's from LabCorp or Quest, is looking at a complete blood count, looking at a comprehensive metabolic panel. That's going to involve liver function and kidney function, looking at T and B cells, what's called an immune panel or a sublymphocyte panel. If you can, looking at natural killer cell function, if that's possible. SED rate is a marker of inflammation. C-reactive protein is also a marker of inflammation. And what's interesting about C-reactive protein is that it's been, in some individuals it's been found to be high. And that was one of the things that actually improved with some of the early research into hyperbaric oxygen therapy in autism. Looking at immunoglobulins to see if there's a deficiency, and then basically doing some antibody testing for different herpes viruses as well as measles, mumps, and rubella. So this kind of rounds out the basic overview of an immune panel along with a metabolic panel. All right. So what about non-steroidal anti-inflammatory drugs and just the use of ibuprofen itself? Well, it needs, when you use NSAIDs, got to make sure that you're taking them with some food. But it has been shown that NSAIDs and probiotics actually help to reduce this nitric oxide that gets produced by microglia. And what they're advocating is generally using more of a prescription strength of ibuprofen versus just the smaller dosing you might get off the shelf from your local drugstore if you bought it over the counter. Now, again, important that you're working with a doctor in doing this because you don't want to just be self-administering ibuprofen, for a prolonged period of time without some physician oversight. Okay, so this is straight from their information, by the way. And the dosing recommendations are anywhere between 20 to 22 milligrams per kilogram 3 times a day. I usually am a little more conservative when I start. I might start, around 10 to 15 milligrams per kilogram and then kind of work it up from there. I kind of want to get a sense of how a child might respond. Generally, the introduction of the protocol is using it for the first 10 days of each month, so about 10 days on, 20 days off. I've had some experience where I actually did 15 days on and 15 days off, and that seemed fine for some kids. So it's something that it can be adjusted. It's not something that's etched in stone per se. You can also get ibuprofen compounded because you can get it as an oral if your child can't take, let's say, the capsule of it. So that is certainly another option as well. And generally, you're dosing it about every 6 to 8 hours. Normally, if you go buy ibuprofen off the shelf at a local drugstore, the dosage you're going to get is anywhere between 7.5 to 10 milligrams, dosed at about every 6 to 8 hours, and that's usually for general purposes of fever and pain. What's happening with respect to this protocol is you're trying to use a higher dose to really get after those microglia that may be activated. So sometimes we're using twice the amount of what is generally recommended off the box. It's important to take with food because NSAIDs can cause some intestinal irritation, and it's also important to be repeating blood work, periodically, looking at kidney function, looking at liver function along the way too. Ideally, about every 6 weeks. I understand it's difficult sometimes for kids to get blood testing that much. I've not personally seen any problems with liver or kidney function in any person that I've been working with. It's probably less of an issue because you're cycling on and off the NSAIDs, so it's not like they're taking it continuously. If you take ibuprofen continuously for months on end, it certainly can not only lead to ulcers, but it can be hard on the kidneys. Granted, it's going to be somebody who already has kidney deficits is going to be more susceptible to that. So let's just look at some of the research on NSAIDs and microglia activation and see if there's any additional information that's worth knowing about. Well, there's a lot. Okay. Matter of fact, this is just research that comes from the SEIA group that shows that the main cellular target of NSAIDs appears to be microglia, and this is out of a research article in Neuroinflammation in 2003. Again, NSAIDs responsible for decreasing activated microglia. NSAIDs responsible for modulating the overproduction of nitric oxide. And they've even talked about NSAID use with regards to microglia activation in Alzheimer's. Probiotics are important. We know that probiotics are important not only to replace some of the good bacteria in the gut after an antibiotic, but these probiotics also help to improve the mucosal lining, making it less permeable, less penetratable by GI pathogens, and less vulnerable to the toxins that they produce. And so high-dose probiotics are an absolute necessary thing to consider with respects to NSAID use, in this type of protocol. And generally, what the SEIA group has talked about is the research has shown is that in many situations, upwards of 200 billion organisms, a 200 billion organism count given twice daily is necessary to create that buffering effect, if you will, in the digestive tract. Now, that's a lot of probiotic. That's not going to be toxic by itself, but in some sensitive people, high-dose probiotics can lead to loose stools. So some of it is based on tolerance, but that's kind of the target, you're trying to get. And there's research behind that, talking that, probiotics can prevent against GI side effects with non-steroidal anti-inflammatories, and that probiotics can have a beneficial effect at decreasing the pro-inflammatory immune chemicals that often get produced with respect to chronic infections. Okay, so again, stopcallingitautism.org is a great place to start to become more educated about this type of approach. Well, what are some other treatment considerations that may be helpful for brain inflammation? Well, there's a lot of things out there. A lot of it, with respects to the essential fatty acids, particularly omega-3 fatty acids. There's a wide range of use, 2 grams, 3 grams, 5 grams daily in some cases. I think it's just, across the board important to get individuals started on some type of omega-3, whether it's something like ultra omega-3, cod liver oil is not bad, and other. It's just important to get started on something. 1 gram to 2 grams total omega-3s a day is a good way to go to just get the process starting. There are people who take upwards of 10 grams a day for certain psychiatric conditions. But again, if your child's not taking some fish oil or omega-3 fatty acids through a fish oil, it's highly recommended. I really personally like for a lot of kids to start the cod liver oil, a teaspoon or 2 a day. And a couple things. Not only are you getting the EPA and the DHEA from the cod liver oil, but you also get some beneficial natural vitamin A, which is important for the epithelial lining within the digestive system and the respiratory system. And that natural vitamin A is known to have a beneficial effect on the eyes. And it is known in some kids, not all, to help with some of the visual stimming that they do. So it's at least something that you can try. Some other anti-inflammatory and antioxidants. New Beginnings carries a couple things. Curcumin, there's a lot of research behind curcumin as far as having an anti-inflammatory and a beneficial antioxidant effect, and quercetin the same way. So these are some other things that can be used if you're looking to kind of decrease the oxidative stress that may be occurring. Now, in some kids who are really phenol sensitive, they may have an intolerance to this, where they get red cheeks, they get red ears, their pupils get dilated, they get overstimulated and hyper. If that has happened, just keep that in mind. That's, again, it's not a toxic thing per se that it's not causing organ damage, but it does cause some behavioral issues, and if that's the case, the supplement really needs to be stopped. Another interesting remedy that is useful and is being used quite a bit across the board. I was actually at an anti-aging conference about 5 years ago where I heard the head neurologist for the Pittsburgh Steelers talking about brain injuries and concussion injuries in pro football and some of the research they were doing with respects to chronic traumatic encephalopathy. And they found that in many of these athletes who have a number of concussions, some of them who have died, when they study their brain, they have chronic microglia activation. And he was talking specifically about the fact of, he was advocating at that time the use of resveratrol as a way to decrease inflammation in the brain. And resveratrol has actually become quite a popular supplement in the health food fields as a way, to try to deal with this kind of thing. And resveratrol is a compound that's found in red wine and grapes, and it's not only been shown to be helpful for oxidative stress, it's also been helpful against seizures and other neurodegenerative disorders. And there it is, it's primarily helpful against microglia activation. 500 to 1,000 milligrams daily, may be needed in some cases. Probably about 500 milligrams a day is probably not a bad place to start. Again, some of these supplements, there really is no criteria based on age or weight. You kind of just start where you are, half a capsule, one capsule if it's a real small child, and then kind of work up from there. The difficulty with some of these remedies is sometimes you don't know, how well they're working. I mean, you're giving it preventatively, but it's not like you're getting this automatic, noticeable effect, like a child automatically starts talking or they automatically start, being less hyper. Some of these things don't work that way. And so in some respects, you're kind of giving some of the stuff on good faith because you know, at least chemically, that it's healthy and helpful for overall brain health. Let me talk real quickly here about medicinal cannabis. Now, I'm going to preface this in the fact that I am not an expert in medicinal cannabis. I have an active interest in this. I've had a number of parents contact me, over the years, and even recently, who are interested in it, who are looking into it. Unfortunately, some of them live in states that don't have a pro-marijuana law, and that can be a problem. But let's just look at it, from a standpoint of what some of the research shows. Well, it turns out that the body has a wide variety of cannabinoid receptors, particularly C1b and CB2. So CB1 receptors are specifically or closely linked to the THC activity. It's the THC that has that psychoactive effect when somebody takes marijuana. The CB2 receptors is mostly linked to the non-psychoactive cannabidiol, that CBD component. So most docs who are looking at medicinal marijuana are looking to induce activity at the CB2 level, not necessarily at the CB1 level, although there is some research that shows that even CB1 receptor activity through THC can have a beneficial effect on brain inflammation. And what is it doing? Essentially, these receptors are expressed on microglia cells and astroglia cells. So if we can positively influence CB2 receptors by decreasing microglia activity, we can decrease inflammation and not get high, essentially. Okay? And this was just another study that was talking about microglia activation in Alzheimer's, and that these cannabidiols can have a neuroprotective effect against beta amyloid production, which we know will trigger the microglia activation. Okay, and again, so cannabidiol has an anti-inflammatory properties. Well, kind of the same thing is going on in research in Alzheimer's is also going on in other disorders. Matter of fact, some research out of Temple University School of Medicine has found that these marijuana-based treatments are effective in stroke patients as well as individuals with multiple sclerosis. So the take-home point here is there's a lot of research out there. There's a lot of stigma behind this because of the media's attention, and what you get with people out there actively, smoking pot and getting high and just kind of hanging out and doing nothing, versus some of the legitimate medicinal uses of this, which I think are tremendously valid and useful and need to be in play more. It used to be we would prescribe, and I've done it over the years. I haven't done it in many years now, but there was a medication called Marinol. Marinol was actually synthetic THC, and it was really used to help induce appetite in AIDS patients and in cancer patients undergoing chemotherapy. Well, there was some research that came out of the Autism Research Institute a number of years ago about the use of Marinol in autism in helping with aggressive behavior, and I actually found that it was fairly helpful. But that was also at a time when there was a lot of scrutiny going on with respects to marijuana, some of the bad media around it, and there was a major pushback within the non-biomedical arena, the non-biomedical community involved in autism, that was just sort of up in arms, that people would be advocating giving autistic individuals, what they call dope, and try to get them high, and that was not the point. So the whole Marinol use kind of fell by the wayside. But it is something that I think is coming back, and I think is gaining traction. and I know there's a number of parents who have used it on the side, or maybe now are in states where they can actually get the CBD, and it's showing great benefit, particularly with respects to aggressive and self-injurious behavior and some of the other behavioral problems as well. So the goal, again, is not to get kids high. It's to try to be more specific at inducing that CB2 activity to have a effect on inflammation. And then this brings this discussion to something called Charlotte's Web. And this is a strain of medicinal cannabis that can be processed into an extract for oral use. And it's very high in cannabidiol, CBD, the non-psychoactive component that is shown to help decrease microglia activation, brain inflammation. It's essentially considered to be a hemp-derived food product with less than 0.3% THC, okay? And it was named after a young girl by the name of Charlotte Fiji, I believe her last name is pronounced. So she was a young girl with something called Dravet syndrome, where it's a condition of uncontrollable seizures. This kid would seize about every 20 minutes. And you can look them up online, and there's videos that you can watch through TED where one of the persons that developed this compound was talking about. Matter of fact, he was one of the Stanley brothers. There's an organization called Realm of Caring at roc.us. It's a nonprofit foundation put together by a group of brothers, and they were highlighted on the CNN special with respect to medicinal cannabis. They're located in Colorado, and they produce these CBD tinctures for medicinal cannabis. And they're primarily used, at least originally, for seizure disorders. And in this particular girl, this Charlotte, it was miraculous. And if you look at the videos, it's unbelievable. They're branching off into other areas, multiple sclerosis, Parkinson's, Alzheimer's, other neurological conditions. And I've been in communication with a few parents who've been lucky enough to use some CBD tincture with their children, and they are in legal states, Colorado, etc., and have seen tremendous benefit. Okay, improved mood, less aggression, less self-injurious behavior, less anxiety, and less obsessiveness. So, if it's something you're interested in, I would recommend starting your research at roc.us. Now, there are state boundary laws, legal laws. It's all based on the state that you're in. So again, I'm not an expert on this. You'd have to talk to somebody who's more familiar with the legality of it, depending on where you are. But the realm of caring would be a good place to start. Okay, so we're going to wrap up here on hyperbaric oxygen therapy. HBOT's been around a long time. This is an image here of a hyperbaric oxygen chamber, nor the hard-shelled chambers, which you'll find in hospital settings or outpatient clinics. And then kind of a family favorite or parent favorite is the soft-shell chambers that can be done at home. These are called inflatable chambers. Now, the vast majority of these inflatable chambers don't provide 100% oxygen per se, but they can use an oxygen concentrator that can get close, because what you're doing is filtering out nitrogen in the air, and you're increasing oxygen concentration that way. And the technology behind that, this slide actually should be updated a little bit, but the technology behind that has been able to get a much higher level of oxygen than existed even 4 or 5 years ago. Okay, but again, it's all about the beneficial effects that you get from hyperbaric. Dr. Ronzagall had done a study back in 2007. He was looking at blood markers of C-reactive protein, which is a marker of systemic inflammation. And he found that when they were elevated, they could be decreased not only at the 1.3 atmosphere chambers, but at 1.5 as well. So 1.3 atmosphere chambers are generally the soft chambers. 1.5 is usually what you'll get through a hard-shell chamber in an outpatient clinic. So it was felt that maybe partly some of the reasons we're getting a beneficial effect on inflammation through HBOT was the pressure effect itself, okay? Not just the oxygen, but the pressure effect seemed to, potentially having a decreased effect on brain inflammation. And when you get decreased inflammation of the brain, you're going to get increased blood flow to areas of the brain that wasn't receiving that blood flow, and that's called hypoperfusion, low perfusion of blood. We need blood moving oxygen in those areas to sort of give the oxygen that's necessary for the cells in the area to function properly. In some studies with respects to autistic individuals, they've shown upwards of 86% plus have brain hypoperfusion in certain areas. And a lot of times that can be picked up, or at least suspected, on Spec scanning that I had mentioned before. And this typically will worsen with age if nothing is done about it. So decreased blood flow is a problem in anybody, but certainly a problem in autism. All right, let's kind of tie in a few things here that may be going on if you think about brain hypoperfusion. So the thalamus in the brain, which is an area in the center of the brain, which is going to be linked not only to the motor but sensory systems, emotional systems as well. When there is a problem in the thalamus, a lot of times you'll get repetitive behavior or that self-stimulatory behavior. The temporal lobes, very much involved in communication and language. When there is issues of sameness, routines, oftentimes that's linked to problems in the temporal lobes. An area called Wernicke's and Broca are specifically for auditory processing and language development. And again, hyperperfusion being a problem, if it's occurring in the temporal lobes, it's going to affect language areas. I mean, because that's essentially where the language areas are going on. What happens in some cases is you can actually get inappropriate constriction of particular areas in the brain because of stress and hypoxia. And so, you know, the hyperbaric seems to help with that. Okay. So what was originally found in this study, you know, back in 2000? Well, one of the main areas that was benefited with hyperbaric was language and speech. It was not only just in the output of words, but it was the clarity of speech, the complexity and the spontaneity of language. I know this is one of the most troublesome areas for parents, and I wish there was one remedy that helped. I can't say I've seen HBOT help speech and language 100% of the time, but it's helped a significant amount of time, 80, 85%. I have had a few cases where the language didn't come until a parent who actually owned a chamber was upwards of, I think it was, they were upwards of about 150 hours in the chamber before language started to come on board. So we don't know. It's really hard to tell from one kid to the next who's going to talk and who's not, and how many treatments it's going to take. And in this particular case, they owned a chamber at home, and so they just continued with it. It wasn't like they were going to a clinic and only spending, you know, paying for 40 sessions and then calling it quits. They kept at it. Other kids have responded sooner. But from a general standpoint, hyperbaric oxygen seems to help language and speech communication, you know, pretty effectively. Some other things that have been recognized: improve gross and fine motor skills. That's not unique to hyperbaric, but I've seen that too. And I put those in red, by the way, just to kind of highlight that those are kind of important ones and some things that a lot of people ask about. Certainly a lot of times improvement in attention and focusing come about. Sometimes kids feel better. They're less agitated and aggressive. They're more aware of what's going on around them. Everybody's a little bit different. Okay, so a couple benefits to hyperbaric to keep in mind is it not only increases oxygen capacity to the brain, increases blood flow to the brain, which is helpful. It can also improve mitochondrial function in some cases. We know that some kids have mitochondrial issues where their body is not producing energy metabolism effectively at the cellular level. Sometimes hyperbaric can help with that. It can also increase blood flow or new blood vessel formation. So hyperbaric is important from that standpoint. That's why it's many times helpful for people with strokes, because as you do hyperbaric, the brain starts to put down new blood vessels to move around the area where the stroke took place. Stem cell production has been found to help or happen with hyperbaric, and there's other neurochemical effects as well, and even some of the antioxidant effects of hyperbaric, such as inducing glutathione, have been looked at too. Okay, So that is my presentation on brain inflammation and autism. And I know there's probably a lot of questions. I can't answer questions here, but what will happen is if you posted a question, it'll be sent to Great Plains, and they will email that to me, usually within a week or so. If you are interested in having ongoing dialogue with me, whether it's from this presentation, other things that maybe you're dealing with, other webinars that I've done, then I'm always available through Autism Action Plan, which is a parent forum website where you can post questions, not only to me, but you can post to the general membership, and it could be anything. And give me some ideas on supplements, or, what do you think of this product, or my child is doing this behavior, what does that mean? And I answer questions on this on a daily basis. And there's actually a section in Autism Action Plan for private messaging too. And this is it's a monthly subscription. It's $37 a month. There's no long-term contracts. You can join it. You can, unjoin it. You can come back at a later time. It's up to you. But it's been around a long time and very, very useful. A couple other things that we've kicked into gear here is a website called Lab Tests Plus. If you go to labtestplus.com. And this is a place where you can actually order lab tests on your own from Great Plains and a few other labs too. You can order organic acids testing, hair testing, metal testing. You can look at food sensitivity testing. We have salivary adrenal testing on this site as well. So essentially anything that is urine, stool, saliva, and finger prick tests are available for self-ordering. And what happens, you order through the site, test kits are sent, you process them, send it back to the lab, and then the results come to us, and you will get a personalized written review of what the relevant markers indicate, along with some suggestions about things that can be done. So it's been a very useful site that way. The other thing that we added was an area called Which Test. And so there's videos on this site, there's articles on this site, there's videos explaining what the tests do, what they mean. There's videos that give an idea of if these kind of things are going on, which tests may be helpful. And if you have a question about which test may be helpful for yourself or your child, you can go into the Which Test section and just submit your question. And we can give you some feedback and give you some guidance as to what may be helpful in your particular circumstance. And then if you're interested in consulting with me personally, I'm available, for in-person consults. We also do internet as well as phone, health educational consults. You get more information about me at drwoeller.com, and there's my practice number at 951-461-4800, and my email is info@mysunrisecenter.com. So I hope that was good information for everybody, and I enjoy always presenting. We'll see you again in a month with another informative webinar with respects to health information. And I hope everybody's good night, and we'll see you next time. Thanks so much.